Our evidence-based presentation is on urinary tract infections in older adults. It was created and recorded by Hannah Fisher, Hope Harper, Jonabelle Prela, and Noah Sholey. Our PICO question is, in older adults over the age of 65, how does performing urine screenings, compared to not performing urine screenings, help with the accurate detection and diagnosis of urinary tract infections? For this presentation, urine screening includes a urinalysis, urine culture, blood culture, urine dipstick, and we will talk about the different types of urine screening in the comprehensive discussion and summary of our articles.
As for the comprehensive explanation of our research methods, all four articles used in this presentation used a quantitative research method, which means that they used to answer questions about relationships among measurable variables with the purpose of explaining, predicting, and controlling phenomena.
Article 1 and 4 use primary original research, specifically individual studies. For Article 1, it uses a cross-sectional research method, and Article 4 is a cohort study as well as a longitudinal study.
For Articles 2 and 3, secondary pre-appraised research was used, specifically the summaries category. Summaries gather systematic reviews to provide a comprehensive range of evidence concerning management options for a given health problem.
For Article 1, I used CINAHL Ultimate Database. A few key search terms I used were UTI, older adults, and screening. And the rationale behind the article I chose was there was a lot of bolded words in the abstract relating to my search terms, UTI and older adults. It also exhibits signs and symptoms of UTI, which could be good information to include in the research for relevance and quality connection to the PICO question, especially the accuracy and importance for early detection. For Article 1, a few key takeaways I found in the article was urinary tract infections are one of the most common preventable reasons for people with dementia being admitted to hospital, even though UTIs can often be treated successfully in the community. The most common way for screening for UTIs in the older population under 65 was to use the urine culture, which is just a urine sample collected by holding a sterilized specimen bottle in the urine sample. The article speaks upon the difficulty screening for patients older than 65, as there are usually other underlying conditions. In the aging population, they consider a person-centered approach, which is when you take a patient's history with the family member or caregiver available to help obtain the necessary information. Tools such as the comprehensive geriatric assessment can be a thorough way to assess a patient's symptoms along with other issues. A comprehensive geriatric assessment can be useful in supporting a symptomatic and thorough evaluation of an older person's symptoms and other issues.
So the database used for Article 2 was CINAHL Ultimate. The search terms used were UTI, urinary tract infection, or urinary tract infections. The second search term was seniors or older adults or elderly. The rationale for this was that, as mentioned before, it was the bolded words that were critical to supporting our research. Urinalysis was found to be helpful, but a study was done to ensure further knowledge for accurate outcomes. Due to challenging efforts of maintaining an accurate urinalysis outcome, a study was done with the use of machine learning. Not only does ML allow improvements in diagnostic performance for UTI, but it also does it in a timely manner. This approach considers symptoms and optimizes risk prediction. The study was conducted through the use of low-cost devices which measured activity, sleep, and nocturnal physiology. The main takeaways for this was that 6 different methods were tested for predicting UTI events in regards to their effectiveness. Upon verification, logistic regression displayed the best performance. It was able to successfully predict UTI risks up to 2 days before any recorded clinical urine tests. During the study, it was evident that during the night, your respiratory rate, heart rate, and the number of wake times were all positively correlated with a higher risk score of UTI.
For Article 3, the database I used was Academic Search Complete. For search terms, I used urinary tract infection, older adults, and urinalysis. And the rationale for the article was I found that the content of the article aligned well with the PICO question, and it appeared to be a summary which is high quality research. So, for some key points in Article 3, early testing is important to help prevent delirium. Urine cultures are an important tool to use when an older adult is showing symptoms of a UTI, which can be shown as flank pain, fever, burning, urgencies, and dysuria. However, it is important to keep in mind that some people don't experience these symptoms, especially individuals placed on locked units in nursing homes. And it is important to know what kind of cultures and their sensitivities in order to treat the UTI before it leads to something more severe, such as sepsis. Some more key takeaways: pairing a blood culture with a urine culture can provide an accurate diagnosis of a UTI. And due to high rates of asymptomatic bacteria, it is important to be purposeful with performing urine cultures. Urine cultures in older people should be limited to patients with typical symptoms of a UTI and patients unable to provide a history. Best practice calls for the results of a urine sample to come back before prescribing antibiotics to try and prevent antibiotic resistance.
The database in which I found my article was through PubMed Central, which is a database for biomedical peer-reviewed journals from the United States National Institute of Health's National Library of Medicine. For my search terms, I used elderly or nursing home or older adult. My second set of terms were urinalysis or urine culturing, and my third set of terms were ABU or antibiotic or infection. I chose this article first by reading the abstract to see if it contained any relevant information towards answering our research question. I found that this article provided a previously unforeseen perspective on testing urine for UTI in seniors, in which I wanted to examine further. For Article 4, this research study examines the relationship of testing frequency for suspected UTIs using urinalysis and the rate of antibiotics being prescribed in long-term care centers. It identifies the concern with overdiagnosis of UTIs that are actually asymptomatic bacteriuria, which is defined by Public Health Ontario as the presence of bacteria in the urine without any signs and symptoms of a urinary tract infection. Asymptomatic bacteriuria is more prevalent in the elderly and those in care homes than the general population. This paper outlines potential consequences of overprescribing these antibiotics, such as increased risk of infection and antibiotic resistance. As for the main takeaways of this article, over a period of 3 years, this study analyzed 519 Ontarian nursing homes quarterly for urine cultures performed, as well as antibiotics prescribed. Conclusions for this study determined that care homes with increased urine testing also had increased levels of antibiotic prescribing. Also discussed in the findings is that facilities with higher rates of testing and antibiotic usage had increased incidence of the infection C. difficile or C. diff.
To start the comprehensive discussion and summary of our articles, we're just going to start with diagnosing. It is often quite difficult to diagnose a UTI in older adults. Urinary tract infections are the most common infection in older adults. A wrong diagnosis can lead to antibiotic resistance due to the overtreating of UTIs. It is best practice to get the result from a screening before prescribing antibiotics. Older adults show different symptoms than other people, especially those diagnosed with dementia, and urinary tract infections are one of the most common preventable reasons for people with dementia being admitted into the hospital.
A few types of urine screening we spoke about in our presentation were urine dipstick, which can predict a UTI in adults under the age of 65 years, and the certainty of this diagnosis is increased if positive for leukocytes and nitrates. A urinalysis is a group of tests that are used to examine urine for a variety of substances. If there are nitrates or leukocytes in the urine, it could indicate a UTI. A urine culture can be a useful diagnostic tool if a clean catch is guaranteed. It involves growing the bacteria in a controlled environment and identifying the exact bacteria growing. And lastly, a blood culture is a positive blood culture when the individual does not have any other infections is consistent with the UTI. It is especially useful if the urine culture also displays the same organism results as the blood culture. It is important to have urine screening because screening in older adults is considered due to specific symptoms but has controversy with underlying illnesses such as delirium or dementia. The comprehensive geriatric assessment can be useful in thoroughly diagnosing symptoms and other issues related to UTI. A person-centered approach is a great way to help with screening as it involves a patient's history in collaboration with a family member or caregiver. Logistic regression displayed best performance in successfully predicting UTI risks up to 2 days before any recorded clinical urine tests.
While screening can be an important diagnostic tool for many urinary tract infections, screening can lead to increased inaccurate doses of a UTI, many which are simply asymptomatic bacteria in the urine, which is at an increased prevalence in older adults. These inaccurate diagnoses can lead to more harm than good due to the overprescribing of antibiotics to treat these presumed UTIs. Risks can include antibiotic misuse and overuse, side effects and adverse reactions, and an increased risk of infections such as C. diff.
To sum up the information gathered from our articles, it was evident that urine screening is critical when it comes to detecting and managing health conditions such as UTIs. This not only is helpful when it comes to the diagnosis, but it also avoids further health complications and preventable hospitalizations. A urinalysis may be considered as a rapid detector, but it is not the most reliable way to diagnose UTIs correctly in the older adults population. The challenge may be in relation to urinary incontinence, cognitive impairment, sample contamination, or previous use of antibiotics. Through the studies done within our articles, it was displayed how advanced technology being paired with urinalysis allows further investigation in order to enhance accurate outcomes.
And these are the references we used for this presentation. We love APA. We love research. We hope you loved our presentation.